How to become a home healthcare nurse. Home healthcare nursing information and overview. Home healthcare is allowing the patient and their family to maintain dignity and independence. According to the National Association for Home Care, there are more than 7 million individuals in the United States in need of home healthcare nurse services because of acute illness, long-term health problems, permanent disability or terminal illness. Home healthcare basics. Nurses practice in a number of venues: hospital settings, nursing homes, assisted living centers, and home healthcare. Home healthcare nursing is a growing phenomenon as more patients and their families desire to receive care in their homes. The history of home healthcare stems from public health nursing, where public health nurses made home visits to promote health education and provide treatment as part of community outreach programs. Today, academic programs train nurses in home care, and agencies place home healthcare nurses with ailing individuals and their families depending on the nurse's experience and qualifications. In many cases, there is a shared relationship between the agency and the academic institution. Many changes have taken place in the area of home healthcare. These include Medicare and Medicaid, and long-term care insurance reimbursement and documentation. It is important for the nurse and nursing agency to be aware of the many factors involved for these rules and regulations resulting from these organizations. Population and demographic changes are taking place as well. Baby boomers approaching retirement and will present new challenges for the home healthcare industry. Technology and medical care in hospitals has led to shorter inpatient stay and more at-home rehabilitation. Increases in medical outpatient procedures are also taking place with follow-up home care. This has resulted in the decrease of mortality rate from these technologies, and medical care has led to increases in morbidity and chronic illness that makes the need for home healthcare nursing a greater priority. Home healthcare nurse job description. Through an array of skills and experience, home healthcare nurses specialize in a wide range of treatments: emotional support, education of patients who are recovering from illnesses and injury for young children and adults, to women who have experienced recent childbirth, to the elderly who need palliative care for chronic illness. A practicing nurse must have the skills to provide care in a unique setting such as someone's home. The nurse is working with the patient and the family and must understand the communication skills for such dynamics. Rapport is evident in all nursing positions, but working in a patient's own living space needs a different level of skill and understanding. There is autonomous decision-making, as the nurse is no longer working as a team with other nurses in a structured environment, but is now as a member of the family team. The host family has cultural values that are important and are different for every patient and must be treated with extreme sensitivity. Other skills include critical thinking, coordination, assessment, communication, and documentation. Home healthcare nurses also specialize in the care of children with disabilities that requires additional skills such as patience and understanding of the needs of the family. Children are living with disabilities today that would have resulted in mortality just 20 years ago. Genetic disorders, congenital physical impairments, and injury are just a few. Many families are familiar with managing the needs of the child, but still need expert care that only a home healthcare nurse can provide. It is important that a home healthcare nurse is aware of the expertise of the family about the child's condition for proper care of the child. There are many complexities involved, but most important, a positive attitude and positive reinforcement is of utmost importance for the development of the child. Medication coordination between the home healthcare nurse, doctor, and pharmacist ensures proper management of the exact science behind giving the patient the correct dose, time of administration, and combinations. Home healthcare nurses should be familiar with pharmacology and taught in training about different medications used by patients in the clinical setting. Many advanced practicing nurses are familiar with medication regimens. They have completed graduate-level programs. Home healthcare agencies believe that a nurse should have at least 1 year of clinical experience before entering home healthcare. Advanced practicing nurses can expedite that training by helping new nurses understand the home healthcare market and teaching. Employment and salary. According to the United States Department of Labor, there were 2.4 million nurses in America, the largest healthcare occupation, yet many academic and hospital organizations believe there is a gross shortage in nursing staff. The shortage of nurses was 6% in 2000 and is expected to be 10% in 2010. The average salary for hospital nursing is $53,450, with 3 out of 5 nursing jobs are in the hospital. For home health care, the salary is $49,000. For nursing care facilities, they were the lowest at $48,200. Training and continuing education. Most home health care nurses gain their education through accredited nursing schools throughout the country with an associate degree in nursing, ADN, a Bachelor of Science degree in nursing, BSN, or a master's degree in nursing, MSN. According to the United States Department of Labor, in 2004 there were 674 BSN nursing programs, 846 ADN programs. Also, in 2004, there were 417 master's degree programs, 93 doctoral programs, and 46 joint BSN doctoral programs. The associate degree program takes 2 to 3 years to complete, while bachelor's degrees take 4 years to complete. Nurses can also earn specialized professional certificates online in geriatric care or life care planning. In addition, for those nurses who choose to pursue advancement into administrative positions or research, consulting, and teaching, a bachelor's degree is often essential. A bachelor's degree is also important for becoming a clinical nurse specialist, nurse anesthetists, nurse midwives, and nurse practitioners, U.S. Department of Labor, 2004. All home health care nurses have supervised clinical experience during their training, but as stated earlier, advanced practicing nurses hold master's degrees, and unlike bachelor and associate degrees, they have a minimum of 2 years of post-clinical experience. Coursework includes anatomy, physiology, chemistry, microbiology, nutrition, psychology, and behavioral sciences and liberal arts. Many of these programs have training in nursing homes, public health departments, home health agencies, and ambulatory clinics. U.S. Dep. of Labor, 2004. Whether a nurse is training in a hospital, nursing facility, or home care, continuing education is necessary. Healthcare is changing rapidly, and staying abreast with the latest developments enhances patient care and health procedures. Universities, continuing education programs, and internet sites all offer continuing education. One such organization that provides continuing education is the American Nurses Association, ANA, or through the American Nurses Credentialing Center, ANCC. Conclusion. There are many rewards to becoming a home healthcare nurse. Some rewards include the relationship with a patient and their family, autonomy, independence, and engaging in critical thinking. The 21st century brings with it many opportunities and challenges. We must meet these challenges head-on. There is an aging baby boomer population, a growing morbidity factor due to increased medical technology and patient care, and the growing shortage in nursing care.